My name is Joy Molyneux, and I had a major brain aneurysm in 1989, and they had to do brain surgery because I was bleeding in my brain. And I've done a good progress. I learned how to walk and talk all over again, add and subtract and things like that. But unfortunately, I'm very exhausted all the time, and I still have some residual numbness all on my extremities. Oh, I'm not saying it right. My legs and my arm, and some days the more I use my leg, the number it is, where I can't even feel my foot or the whole lower leg at all.
Okay, Joy, we're going to test your reflexes.
Mm-hmm.
I know these are a little bit hyper-reflexic.
Yes.
Okay. That's quite a response you have.
Mm-hmm.
Okay.
Not a good one.
No. Let's see about this one.
Wow.
Okay.
It's getting worse.
Okay. So that's basically what happens to you every time somebody checks your kneecap reflex.
Oh yeah.
Patellar
It's
reflex.
getting worse.
Now we're going to test you for sensation. I'm going to touch you first with this little paper clip
Mm-hmm.
on your face. Can you feel that?
Mm-hmm.
Can you feel that?
Mm-hmm.
Yep, it's the same?
Almost. It's not as good as on the right,
Okay.
my affected side.
Which side? The right is not as good?
It's not as good, yeah, my affected side.
I'll go here, here. Still not as good on this side?
Not as good, but I can feel it.
Go down your arm,
Mm-hmm.
down your arm.
I don't feel that.
Legs,
Okay.
here, down, all the way down. And you feel that, right?
I feel that.
It's normal, right?
Mm-hmm.
How about here?
I don't feel it as much. I feel something.
A little.
Very light something.
Do you feel it
I
down
don't
here?
feel it
Here you feel?
hardly.
No? Tell me when you start to, wait, here. How about here? You don't?
I feel something, but I don't know what it is.
Joy, you just had your treatment about an hour ago, give or take.
Yeah.
And can you tell me what you feel like?
Well, I'm really excited because, well, after the treatment, I was touching myself, and I can feel my fingertips on my right affected side where I had the stroke. I've always been numb on my right side arm and leg, and I started feeling my leg, and I'm like, I can feel it better. I mean, it's more than significant. And I tried this a couple of days ago to try to see if I could feel my pulse, feeling with my right hand and fingertips, and I could feel my pulse for the first time in probably 11 years, 10 years since I had the stroke. And so I'm really excited because, you don't really understand how devastating it is not being able to feel your fingers, your foot, your leg, to try to type, and you don't know what your fingers are doing, and you don't know, you want to hold somebody's hand, but you can't use your right hand because you can't feel them, or, all kinds of things. I always had to concentrate and watch what my hand was doing because I never knew what it was going to do. I couldn't feel anything. Or when you go in the ocean, you can't feel your leg. It's pretty scary. And so I feel already a lot better. But also another interesting thing is that I came here today, every bone and every muscle in my whole body hurt. And now I think I know what it feels like to be normal for a change.
Wonderful.
So
that was with one Relox treatment?
Just one. First time I came here.
Great.
It's my first
Wonderful.
visit.
I'm glad to hear that. Can I test your reflexes?
Sure.
We checked you last time.
Okay, I gotta relax.
Okay. Good.
Whoa. Usually I'm jumping all over the place.
Yeah.
Much better. This is a really bad one. I'm not going like this, like I'm having.
Yeah, I'm trying.
Unbelievable.
Do it one more time, Bruce.
Sure.
That's fabulous. Unbelievable.
I'm hitting you
Every
pretty hard,
doctor
so-
I've gone to who's done that, I've been jumping all over the place for 10 years.
Really?
Yeah.
Wonderful. I'm going to check your sensation now.
Okay.
A little pin.
is my good side. Feel
Feel?
feel everything perfectly.
Okay.
Feel much more. I feel, yeah, I can feel, especially by my hand. It's like I can feel it perfect right there.
Really?
And this is my worst part.
Really? Interesting.
Yeah, interesting. Yeah, I feel that. Very, very sensitive. Much
Yeah.
more sensitive.
Is it as normal as the other side or not yet?
I think pretty much, pretty close.
If
Pretty
this
close.
If this is a 10, how would you rate this?
This is an 8 when it used to be a 0.
Okay.
Or a 1.
Or a 1? Okay.
Yeah.
Let me see.
Yeah, I have to compare. Now, I really feel a lot now. This is my, interesting, this is the most numb part. I can feel it in my foot. I can feel my
Really?
foot.
Really? Okay.
Go to my toes. I want to feel my toes. This is strange.
Right there?
Yeah, I can feel that.
Yeah?
Yeah.
Okay.
It's significant. Very significant.
Okay, thank you.
Okay.